Kaiser, California had those type of cameras in. Did they put them in during COVID too? And they were thermal cameras? I'm just curious. Because I just did a video about Sutter Healthcare System in Sacramento, California. I couldn't even read all of the article, but it is so bad. Like, and I've been trying to tell people, like, we have a lot of enemies to the country, but the hospital CEOs, I could bring them up, not just because some axe to grind. No, they're literally psychopaths. Like, and this idea that they should just be fined. Wait till I read what this, a couple of, people at the state level in California had to say about Sutter and what they were doing. They literally should be locked up in prison, or they maybe should be put on a state forensic unit for, 50, 60 years. Because think about it, they're not just some CEOs over a retail store or a bunch of retail. They have people's lives, and they are the head of it. So they should not just get a fine. Fuck that. Listen to how bad these, and here's what makes them even more psychopaths, is that like when, and they go on to say this in this article, that usually when monopolies monopolize, like McDonald's, they lower prices for the consumer. The hospitals, because it's going on in other states, not just California, but Sutter, at least the article says, was the model that many of your major universities, hospitals have done. And that's what happened here. It started like 10 years ago. Northwestern, the Beast downtown, just started buying everything up. So they're right about that. But they said that they're driving up the prices, because I've said this for years now to people. And I think people think, well, we can't worry about the healthcare. No, you should. You really should. Because these people are such monsters that the more money they get, don't want to lower prices for consumers. They're raising them because they control the market. They cornered it. So when I call these jagoffs, that's being nice to them. But there should be no like financial, and Sutter doesn't pay taxes. So they walk away with billions and no property because they're nonprofit. So there was this other woman that she was in this article. She's Hillary Ronan. She's a member of the San Francisco City and County Board of Supervisors and sits on the Budget Committee. She feels powerless in this, because she goes on to say, that money comes from the same pot of money that we use to build new homeless shelters, to hire firefighters, to pave our streets, to repair our parks. And the more we're paying on employee health care, the less we're paying on the toughest entrenched problems we're trying to fix in San Francisco. A reason their health costs were so high, she says, is because Sutter was able to block the city and its insurers, Blue Shield of California, from steering employees to hospitals with lower prices. And it was able to prevent Blue Shield from telling the city that Sutter hospitals would charge for individual procedures. Sutter won't allow us to see how much they charge for their services. It's unbelievable to me. And so we can't do any comparison shopping. And they keep naming their price, and I feel like I'm handcuffed to do anything about it. She goes on to say here, too, that for once the insurance companies aren't the problem here. She said, Blue Shield is at the whim of Sutter, naming its price as we are. For once in their life, the insurance company is not the worst actor in the room. It's Sutter. The state accused Sutter of using its windfall from its excessive pricing to finance the acquisitions of new hospitals and physician groups, and to pay its outgoing CEO $13 million in 2016, and a year later paid its new CEO $6 million. It galls Hillary Ronen that Sutter is a not-for-profit company, meaning legally it pays no taxes, even though it earned $13 billion in revenue last year. Unbelievable. And tens of billions of dollars a year in local property taxes. And one hospital alone, they're avoiding having to pay $20 million a year in property taxes. Which suggests that they're not out for financial gain. That's what makes it really sick, because they're in the billions, and yet they keep pushing their power in this sick direction. So it's like, it's not about money anymore. It's about, they've cornered the market. So they're hurting people. They shouldn't be fined. They need to be apprehended because they're a danger to society. I mean, I know about this stuff. I'm a psych nurse. You know, we don't let you just go around, you know, being on the street when you're a danger to yourself or others, when, you know, you're a credible danger. Sutter, and so all of these hospital CEOs that did this, because they intentionally did it. I just in my last video said, they intentionally did this. This goes on to say, any way you look at it, any path you look, we are getting screwed. That sentiment is shared by one of the state's largest labor unions and the United Food and Commercial Workers, as well as many of the state's large employers that belong to the Pacific Business Group on Health, headed by Elizabeth Mitchell. And then Elizabeth Mitchell said, as an example, they control maternity care. According to the lawsuit, Sutter used its leverage to force the big companies and their insurers into what are called all-or-nothing contracts, meaning that they had to include all 24 Sutter hospitals in their health plans. And sometimes they would have to include hospitals that were in regions that the employers didn't even have employees in. Sutter was forcing big companies to cover hospitals in places where nobody worked. It's all or nothing. No employer could do without all of the Sutter system. And then Elizabeth Mitchell said, in every other industry, they use their size as they monopolize to reduce prices to consumers. And yet the opposite has been true in healthcare. They merge and then they use their market leverage to increase prices. Coordinated care is what everybody wants. The problem is it has not been achieved in these mergers. We're not setting better outcomes. We're not getting, healthier people. She said what's most alarming is hospitals across the country have been following Sutter's lead. This is happening in Maine, Texas, happening across the country. The largest health systems are buying up everything. I've been saying this for years. It's like, she said, we have seen the data. It's the largest driver of healthcare cost increases. It's the hospital prices, and they're not providing more services. I would say, she goes on to say here, and the quality isn't increasing. It's decreasing. And it's almost like they want it to. Like I've said, since I started this job, it's almost like they want you to get hurt. They want chaos. And that may seem hard for people to believe, but just think about this. The hospital CEOs in this country, they are such a danger to the country and to the community. They really should be taken off the street for a psych eval, but I'm sure they'll have enough money to get out of that. But still, they really should, because they're a danger, clearly showing it. But think about the kind of mind that can do that to people, that would take away your choices. Take away your choices so much so they could screw you over more, hurt you more, keep you from going and getting better care or cheaper care, blocking you from, that's some sick motherfuckers. Just saying. And then Becerra, the Attorney General, says they're waiting to see if an out-of-court tenement settlement is reached, which would only charge Sutter $570. No, they shouldn't be charged anything. Put the bastards in jail. They're a danger to the community.